Nmc Cbt questions and answers. Question number 426. Diabetic patient with suspected liver tumor has been prescribed with triphasic CT scan. Which medication needs to be on hold after the scan? Option A, furosemide. Option B, metformin. Option C, docusate sodium. Option D, paracetamol. The correct answer is option B, metformin. Question number 427. What is the preferred position for abdominal paracentesis? Option A, supine with head slightly elevated. Option B, supine with knees bent. Option C, prone. Option D, side lying. The correct answer is option A, supine with head slightly elevated. Question number 428. Which is not an expected side effect of lumbar tap? Option A, headache. Option B, back pain. Option C, swelling and bruising. Option D, nausea and vomiting. The correct answer is option D, nausea and vomiting. Question number 429. A client immediately following LP developed deterioration of consciousness, bradycardia, increased systolic BP. What is this? Option A, normal reaction. Option B, client has brainstem herniation. Option C, spinal headache. The correct answer is option B, client has brainstem herniation. Question number 430. An assessment of the abdomen of a patient with peritonitis you would expect to find. Option A, rebound tenderness and godding. Option B, hyperactive, high-pitched bowel sounds and a firm abdomen. Option C, soft abdomen with bowel sounds every 2 to 3 seconds. Option D, ascites and increased vascular pattern on the skin. The correct answer is option A, rebound tenderness and godding. Question number 431. Patients with gastrointestinal bleeding may experience acute or chronic blood loss. Your patient is experiencing hematochezia. You recognize this by option A, red or maroon colored stool rectally. Option B, coffee ground emesis. Option C, black, tarry stool. Option D, vomiting of bright red or maroon blood. The correct answer is option A, red or maroon colored stool rectally. Question number 432. What would be your main objectives in providing stoma education when preparing a patient with a stoma for discharge home? Option A, that the patient can independently manage their stoma and can get supplies. Option B, that the patient has had their appliance changed regularly and knows their community stoma nurse. Option C, that the patient knows the community stoma nurse and has a prescription. Option D, that the patient has a referral to the district nurses for stoma care. The correct answer is option A, that the patient can independently manage their stoma and can get supplies. Question number 433. When selecting a stoma appliance for a patient who has undergone a formation of a loop colostomy, what factors would you consider? Option A, patient dexterity, consistency of effluent, type of stoma. Option B, patient preference, type of stoma, consistency of effluent, state of peristomal skin, dexterity of the patient. Option C, patient preference, lifestyle, position of stoma, consistency of effluent, state of peristomal skin, patient dexterity, type of stoma. Option D, cognitive ability, lifestyle, patient dexterity, position of stoma, state of peristomal skin, type of stoma, consistency of effluent, patient preference. The correct answer is option D, cognitive ability, lifestyle, patient dexterity, position of stoma, state of peristomal skin, type of stoma, consistency of effluent, patient preference. Question number 434. If a patient feels a cramping sensation in their abdomen after a colonoscopy, it is advisable that they should do have which of the following? Option A, eat and drink as soon as sedation has worn off. Option B, drink 500 milliliters of fluid immediately to flush out any gas retained in the abdomen. Option C, have half-hourly blood pressure performed for 12 hours. Option D, be nursed flat and kept in bed for 12 hours. The correct answer is option A, eat and drink as soon as sedation has worn off. Question number 435. When explaining about traveler's diarrhea, which of the following is correct? Option A, traveler's diarrhea is mostly caused by rotavirus. Option B, antimotility drugs like loperamide is ineffective management. Option C, oral rehydration in adults and children is not useful. Option D, adsorbents such as kaolin is ineffective and not advised. The correct answer is option D, adsorbents such as kaolin is ineffective and not advised. Question number 436. Young adult is being treated for second and third degree burns over 25% of his body and is now ready for discharge. The nurse evaluates his understanding of discharge instructions relating to wound care and his satisfaction that he is prepared for home care when he makes which statement? Option A, I will need to take sponge baths at home to avoid exposing the wounds to unsterile bath water. Option B, if any healed areas break open, I should first cover them with sterile dressing and then report it. Option C, I must wear my job's elastic garment all day and only remove it when I'm going to bed. Option D, I can expect occasional periods of low-grade fever and can take Tylenol every 4 hours. The correct answer is option B, if any healed areas break open, I should first cover them with sterile dressing and then report it. Question number 437. A 33-year-old male is being evaluated for possible acute leukemia. Which of the following findings is most likely related to the diagnosis of leukemia? Option A, the client collects stamps as a hobby. Option B, the client recently lost his job as a postal worker. Option C, the client had radiation for treatment of Hodgkin's disease as a teenager. Option D, the client's brother had leukemia as a child. The correct answer is option C, the client had radiation for treatment of Hodgkin's disease as a teenager. Question number 438. A 43-year-old African-American male is admitted with sickle cell anemia. The nurse plans to assess the circulation in the lower extremities every 2 hours. Which of the following outcome criteria would the nurse use? Option A, body temperature of 99 degrees Fahrenheit or less. Option B, toes moved in active range of motion. Option C, sensation reported when soles of feet are touched. Option D, capillary refill of 3 seconds. The correct answer is option D, capillary refill of less than 3 seconds. Question number 439. A newly admitted client has sickle cell crisis. He is complaining of pain in his feet and hands. The nurse's assessment findings include a pulse oximetry of 92. Assuming that all the following interventions are ordered, which should be done first? Option A, adjust the room temperature. Option B, give a bolus of IV fluids. Option C, start oxygen. Option D, administer meperidine, Demerol, 75 mg IV push. The correct answer is option C, start oxygen. Question number 440. Clients with sickle cell anemia are taught to avoid activities that cause hypoxia and hypoxemia. Which of the following activities would the nurse recommend? Option A, family vacation in the Rocky Mountains. Option B, chaperoning the local boys club on a snow skiing trip. Option C, traveling by airplane for business trips. Option D, a bus trip to the Museum of Natural History. The correct answer is option D, a bus trip to the Museum of Natural History. Question number 441. A patient was brought to the A&E and manifested several symptoms: loss of intellect and memory, change in personality, loss of balance and coordination, slurred speech, vision problems and blindness, and abnormal jerking movements. Upon laboratories tests, the patient got tested positive for prions. Which disease is the patient possibly having? Option A, acute gastroenteritis. Option B, Creutzfeldt-Jakob disease. Option C, HIV/AIDS fatigue. Option D, urgent bowel. The correct answer is option B, Creutzfeldt-Jakob disease. Question number 442. A 27-year-old adult male is admitted for treatment of Crohn's disease. Which information is most significant when the nurse assesses his nutritional health? Option A, anthropometric measurements. Option B, bleeding gums. Option C, dry skin. Option D, facial rubor. The correct answer is option A, anthropometric measurements. Question number 443. Your patient has diverticulitis for about a decade now. You have assessed her to be having soft stools of type 4/5. Which of the following will need urgent intervention? Option A, she is losing a lot of electrolytes in her body, and this needs to be replaced. Option B, there is no urgency in this case, because patients with diverticulitis are expected to have soft to loose stools. Option C, she needs to be prescribed with fluid retention pills. Option D, there is no urgency in this case because the stool is quite hard, and it should be fine. The correct answer is option B, there is no urgency in this case, because patients with diverticulitis are expected to have soft to loose stools. Question number 444. A client with hemophilia has a nosebleed. Which nursing action is most appropriate to control the bleeding? Option A, place the client in a sitting position. Option B, administer acetaminophen, Tylenol. Option C, pinch the soft lower part of the nose. Option D, apply ice packs to the forehead. The correct answer is option C, pinch the soft lower part of the nose. Question number 445. A client with Addison's disease has been admitted with a history of nausea and vomiting for the past 3 days. The client is receiving IV glucocorticoids, Solumedrol. Which of the following interventions would the nurse implement? Option A, glucometer readings as ordered. Option B, intake output measurements. Option C, evaluating the sodium and potassium levels. Option D, daily weight. The correct answer is option A, glucometer readings as ordered. Question number 446. A client with a total hip replacement requires special equipment. Which equipment would assist the client with a total hip replacement with activities of daily living? Option A, high seat commode. Option B, recliner. Option C, TENS unit. Option D, abduction pillow. The correct answer is option A, high seat commode. Question number 447. The teenager with a fiberglass cast asks the nurse if it will be okay to allow his friends to autograph his cast. Which response would be best? Option A, it will be alright for your friends to autograph the cast. Option B, because the cast is made of plaster, autographing can weaken the cast. Option C, if they don't use chalk to autograph, it is okay. Option D, autographing or writing on the cast in any form will harm the cast. The correct answer is option A, it will be alright for your friends to autograph the cast. Question number 448. The nurse is aware that the best way to prevent post-operative wound infection in the surgical client is to: Option A, administer a prescribed antibiotic. Option B, wash her hands for 2 minutes before care. Option C, wear a mask when providing care. Option D, ask the client to cover her mouth when she coughs. The correct answer is option B. Wash her hands for 2 minutes before care. Question number 449. The rationale for inserting a French catheter every hour for the client with epidural anesthesia is: option A. The bladder fills more rapidly because of the medication used for the epidural. Option B. Her level of consciousness is such that she is in a trance-like state. Option C. The sensation of the bladder filling is diminished or lost. Option D. She is embarrassed to ask for the bedpan that frequently. The correct answer is option C. The sensation of the bladder filling is diminished or lost. Question number 450. What would the nurse expect the admitting assessment to reveal in a client with glomerulonephritis? Option A. Hypertension. Option B. Lassitude. Option C. Fatigue. Option D. Vomiting and diarrhea. The correct answer is option A. Hypertension.